Life can be loud. Crowded streets, constant movement, responsibilities, deadlines, and distractions pulling us in every direction. Most people experience times when life feels overwhelming. For some people, stress goes beyond feeling overwhelmed. Traumatic experiences can leave lasting effects long after that event is over. Certain sights, sounds, smells, or memories can instantly trigger fear, anxiety, or distress. Now, this looks peaceful, doesn't it? One thing that I've learned in life is that peace isn't always about where you are. And sometimes the chaos isn't just around you, it's inside your mind. And that raises a very important question. When you can't escape the chaos, how do you manage it? My name is Billy Morgan. I'm a 10-year veteran of the United States Marine Corps, and I recently earned my bachelor's degree in general studies from Eastern Kentucky University. I'm now also currently pursuing a degree in psychology with a focus on mental health. I also personally live with PTSD, which has led me to explore both clinical and holistic approaches to managing symptoms in my life. The purpose of this video is to share one approach that has helped me manage my symptoms of PTSD and anxiety, especially during the moments when medication is not readily available or when I need an immediate way to regain control of my life and my body. Psychology research shows that certain behavioral techniques, particularly breathing exercises and grounding strategies, can help reduce physiological arousal and improve emotional regulation during stressful situations. A common problem many people experience is sudden anxiety, panic, or trauma-related triggers. These reactions can be brought on by sights, sounds, smells, or stressful environments, making it difficult to think clearly or to stay present in the moment. Not every day can be spent by a peaceful river without the stresses of life. For me personally, certain sensory triggers can immediately bring back distressing memories. At work, in public, or during everyday activities, I can't always remove myself from the situation. For a long time, my response was simply to isolate myself and wait for that feeling to pass. Over time, I discovered a technique called draumbinding, which I learned through Norse-inspired practices. The concept is often described as binding yourself back to the present after becoming lost in overwhelming thoughts, emotions, or memories. After intense battles, it is reported that the Vikings would do this as a way to regain control of their senses. I didn't create draumbinding. Instead, I use it as a tool. For me, draumbinding combines controlled breathing, rhythmic self-soothing actions, and spoken affirmations. Whether someone wants to view it through a cultural, a spiritual, or psychological lens, the goal is still the same: to reconnect with the present moment and interrupt the escalation of stress and anxiety in your life. It's important to note, though, that draumbinding itself has not been studied as a clinical treatment. However, many of its components are similar to techniques used in evidence-based psychological interventions, including breathing retraining, grounding exercises, and cognitive reframing strategies commonly used in trauma-focused therapies. One example comes from a study conducted by Muser and colleagues in 2025. The researchers evaluated a program called BREATHE, which stands for Brief Relaxation, Education, and Trauma Healing. The study included 233 participants with probable PTSD who were receiving services through a large urban mental health agency. Participants completed up to 3 series sessions of focused breathing, retraining, relaxation skills, and psychoeducation about trauma. Researchers measured PTSD and depression symptoms before treatment, immediately after the treatment, and again 3 months later. The results were encouraging, though. Most participants completed the program, and researchers found significant reductions in both PTSD and depression symptoms. Even more importantly, though, those improvements remained at the 3-month follow-up. These findings suggest that relatively brief breathing-based interventions can be practical and effective tools for helping people manage trauma-related symptoms in a real-world setting. Based on both this research and my own experience, techniques that combine breath regulation with grounding tools and focused attention can be valuable tools during moments of intense stress. For me, adding affirmations creates an additional point of focus that helps keep me anchored in the present rather than getting pulled back into those distressing thoughts and memories. At the same time, it's important to note and recognize that coping techniques like this are not a replacement for professional mental health treatment Instead, they can serve as a supportive tool alongside therapy, medication, and other evidence-based techniques. My recommendation is simple. If you struggle with anxiety, stress, PTSD symptoms, consider exploring a structured breathing exercise and grounding technique. Different approaches work for different people, but finding healthy coping tools can help you regain a sense of control during these very difficult moments. When we think about peace, we often imagine places like this river behind me here in Richmond. But real peace isn't always about escaping the chaos in life around us. Sometimes it's about learning how to navigate the chaos within us. Thank you all for watching. I hope this information is giving you something practical to consider and can help some of you in some way. Take care and have a great day.